If I could give you just 3 aftercare commandments, they'd be 1. Be gentle in the first 2 weeks. 2. Be patient through month 3. 3. Be realistic until month 12.
You've done the hard part. The surgery is over, but your new hair, it's just getting started. Today, Dr. Ko is going to walk us through the entire recovery journey, week by week. From scabs to styling, we're covering it all.
Hi, I am Dr. Ko, a hair transplant surgeon in Korea. Hair transplant surgery is just the first chapter. What comes after? The healing, the growth, and the care. That's what determines your final result. Whether you just had your transplant or you're planning one soon, this guide will help you understand what's normal, what's not, and what really matters during recovery. Let's start with week 1, the most critical part of your recovery. This is when your newly implanted grafts are at their most vulnerable state.
Like freshly planted seeds?
Exactly. The grafts haven't fully locked in yet. They're sitting in the skin, starting to form blood supply. But if they're disturbed, they can fall out and never regrow. Day 0 to 2. Most clinics, including ours, do the first gentle cleansing. Day 3 to 5, you'll begin soft shampooing at home. I tell my patients, don't rub, don't spray directly, just let the foam sit and rinse gently. Here is a list of what to avoid. 1. No touching or scratching the recipient area. 2. No gym, no sweat, no alcohol or nicotine. These delay healing. 3. No hats or tight caps that can stick to the grafts. One accidental bump from a helmet, and you could lose a graft. I've seen it happen.
So treat your head like royalty this week?
Yes, and sleep with your head elevated. It helps reduce swelling, especially around the forehead and eyes.
Okay, let's move to week 2. What should patients expect?
This is when the scabs start to come off, and it can look a little scary. What happens is around day 7 to 10, crusts or scabs will naturally begin falling off. We recommend soaking the scalp in warm water and gently massage, no fingernails. It may look like hairs are falling with the scabs. That's normal. You're not losing your grafts, just the hair shafts. The roots are still inside, and that's what matters.
And what about this thing called shock loss?
Good question. Shock loss refers to the shedding of both transplanted and nearby native hairs. It's temporary and part of the recovery process. This is when some patients panic, but I remind them, this is like a reboot. Your scalp is healing and new growth will follow.
Week 3 and 4. A lot of people say this is the toughest emotionally.
It is. This is the phase where things look worse before they get better. Most of the transplanted hair is gone. The scalp may be pink, and patients often feel disappointed. I always tell my patients at this point, don't judge your transplant at week 3. Judge it at 6 months. What you might see: a patchy or thin appearance in the recipient area, redness, especially if you have lighter skin, occasional pimples called folliculitis, as new hairs try to push through. If you get small pimples, apply a warm compress. Don't pop them. They're usually harmless.
So this is when patience really becomes a virtue.
Yes, you may not see growth yet, but everything is happening under the skin.
When does new hair actually start growing?
Between week 8 to 12, we usually see the first signs of growth. It's not dramatic. Think thin, fine baby hair at first. What's normal? 10 to 15% of your final density may show now. The texture is usually soft and wispy. Growth may be uneven, but that's okay. Each follicle has its own clock. Some start early, some take their sweet time.
Anything patients can do to help at this point?
Yes. This is when we might start topical minoxidil again, or offer PRP treatments to stimulate early growth, but only if the scalp is fully healed.
Now we're getting into the fun part. when you actually see progress.
Right. Between month 4 and 6, your hair starts looking more real. It thickens, it darkens, and it starts to resemble what you were hoping for. Hair becomes more coarse and pigmented. Coverage improves, but not yet perfect. Redness fades and the scalp looks healthier. At this point, many patients say people start noticing, and that's a great sign.
So can they start styling their hair now?
Yes, most definitely. At month 6, about 50 to 70% of the result is visible. You can do regular haircuts, styling, even light coloring. Photos and social events? Go for it.
9 to 12 months? Is that when we can call it final?
For most patients, yes. Around month 12, you're seeing 90 to 100% of your final result. In this period, hairs are fully matured in texture and thickness. The hairline looks settled and natural. And if needed, you can consider a second procedure for density or refinement. Remember, even at 12 months, some people, especially those with curly or coarse hair, may see subtle improvements continuing into month 14 or 15. If I could give you just 3 aftercare commandments, they'd be 1. Be gentle in the first 2 weeks. 2. Be patient through month 3. 3. Be realistic until month 12. The grafts know what they're doing. Your job is to protect them.
And that is a wrap-up for today, folks. If you found this video helpful, give it a thumbs up and share it with someone considering a transplant.